Alrighty guys, your fourth day of NTI. What we're going to be talking about is sex-linked traits. Now remember that you have a quiz on Friday. So we want to make sure that you're going to be prepared. So I'm going to go ahead and create an assessment, a practice assessment, to allow you guys to be able to go through all the different types of inheritance that we've talked about this week and make sure that you understand what's going on. If you have any questions, please send me a message on Teams and I will be glad to answer your question. All right, on to sex-linked traits. So what we're going to be talking about is hemophilia. Now, remember that hemophilia is the inability for an individual to clot properly. So those individuals lack a protein, and essentially if they get some type of cut or if they have a bruise, then their particular body will continue to produce that blood within that area, and ultimately they have to make sure that they bandage it in some way, shape, or form. Otherwise, they could lose a lot of blood. So in this case, we have a sex-linked trait. Now, I just want to make sure that everyone remembers that males are XY, females are XX. And so males on the XY, they're represented by squares on a pedigree. Females are represented by a circle on a pedigree. And then remember that if you're shaded in on a pedigree, like these, and these, what that tells you is that that individual suffers from hemophilia. It does not mean that these have a dominant or recessive trait. It means that they actually have the trait. Now, if we were to do a Punnett square between a female, that is big H, little h, and a male, that is big H, what you're going to first notice is that we're not utilizing our typical A's and B's and C's, but instead we're doing our X's with that superscript. So that's how to set up a sex-linked trait. So you have to use the X's and also the XY. Now, notice that there's nothing on the Y. And the reason why is because hemophilia isn't carried on the Y chromosome. It's only carried on the X chromosome. So in this case, this particular female is a carrier. She has a big H and a little h. She will not show the disease in any way, shape, or form. So in order for females to have hemophilia, they have to have two little h's. This male is normal. He doesn't have hemophilia at all because he has that big H. So if we were to do the cross, what we're going to notice is that we get all different types of results. And so for males, we have a X big H, Y, and X little h, Y. Those are your only two possibilities that you can get for males, which means that you can only have a male that is normal or a male that suffers from hemophilia. Males cannot be carriers of the disease. Now, for females, this particular female has big H. This particular female has big H, little h. So in this case, neither one of them will suffer from hemophilia. And you can see that these are the three possibilities associated with that X chromosome. So that you can have the big H, big H, little h, and the little h, little h. The only way that a female suffers from hemophilia is this particular genotype, X little h, X little h. Okay, so that's the Punnett square. Now on to the pedigree. So if we're looking at a pedigree, the sex-linked pedigree is actually really, really simple. Just like what I've said in the past few videos, you have to figure out for a pedigree what information is given. And in terms of the pedigree for the sex-linked traits, all the males are given. You know every single male's genotype. So the first thing you want to do is you want to go ahead and put the sex chromosomes down. Okay, now have all the 6 chromosomes down. We're going to do the males first because, again, the males are the dead giveaway. So this male here has hemophilia. So does he have the little h or does he have the big H? Well, hemophilia is recessive, so he is going to have a little h. Same goes for this male here and this male here. Now, these other males do not have hemophilia, so we automatically can assume that they have a big H. Alrighty, so we're ready for the pedigree now. So, in this case, we'll fill in the rest of the other ones affected by the trait. So, this female is affected by the trait. So then we go back and look, okay, well, wait a minute. Are they big H, big H, little h, or little h, little h? Well, remember that again, hemophilia is a recessive trait. So in order for a female to have the particular disease, they have to be little h, little h. Okay, so that's that particular individual that has little h, and this one as well. Now we're ready to fill in the rest. So, in this case, this individual has to be heterozygous. So, in other words, has to have a big H, little h. The reason why is because they have a son that has hemophilia. In order for the son to have hemophilia, they must have received it from the mom. Because what does the dad always give to the son? A Y chromosome. So in this case, this Y chromosome has to come from dad, whereas this little h must come from mom. This individual has to be heterozygous. And the reason why is because the father has to give an X little h. This individual doesn't have hemophilia, so the other allele must be a big H. Now, we also know this individual here has to be heterozygous. And the reason why this individual has to be heterozygous is because they have a daughter that has hemophilia. And remember, in order for a female to have hemophilia, they must have received the trait from both parents. So, dad would have to give a little h, and mom would have to give a little h in order for this daughter to have hemophilia. This individual here has to be heterozygous. And the reason why is because the father has to give the little h to this daughter. We move on to this one over here, the last one. So, this individual we know has at least one big H because it doesn't have hemophilia. Can you figure out what the next allele would be? So the next allele would be a little h. Alrighty guys, so that's the pedigree for the sex-linked traits. That's the Punnett square for the sex-linked traits. I will post your assignment on Schoology. If you have any questions, again, please let me know on Teams. Thanks guys.